do it. That's my good.
All right, so we are doing partner-assisted scanning, and we want to choose something that was relevant to healthcare professions in general. Depending on what population you're seeing, you may be confronted with someone who is nonverbal and needs another form of communication.
So first, I wanted to ask if anyone is familiar with partner-assisted scanning or has heard of it before. So, as Sammy said, this is a technique you're going to use with someone who might not be able to speak, and that can be like they're not able to speak in day-to-day life, or they might be on something like vocal rest, or they're in the hospital, and at that time they're not able to speak. So this is something you can use in multiple situations that really any healthcare profession in the room is likely that they may have to use this at some point in time.
Also, this is another form of augmentative and alternative communication. When you saw NOAA, that was a high-tech version, and this would be considered a low-tech version. And this could also be used with NOAA as well if maybe if all of a sudden his device died, this would be a great thing to have on hand that he could be able to use, or also if he was going into bed and didn't have his device with him.
So, jumping in here.
Yeah, so we picked it because it's prevalent in hospitals, and then also if you're in small settings, such as you're doing counseling and someone comes in and they had a trauma, it's something that you can quickly discuss with them. Since it's very individualized, you figure out what this person is capable of, and you use that as a basis, and you figure out what they can do to confirm what they would like to communicate. You don't need extensive training, so we're going to show you, demonstrate what you can do with just a simple alphabet. It looks kind of like this. You can kind of make your own, and you just figure out what the person can do, and then you go through the alphabet, and you eventually, the goal is to make a message.
And the good thing about this is, so you don't even need this board. If you have a pen and a piece of paper, you can make this on the fly. Supposing you get to see a client and you didn't realize they're not able to speak, or they have limited range of motion and can't point on a picture communication board, this is something you can do with them, and you can make it on the fly.
Yeah, and it can be very individualized to the client as well. So if this is a client that you felt like needed more than just the alphabet to be able to tell a message, you could have certain blocks. So it maybe have a message or a certain word on it that was very important to them.
Very adaptable.
Yeah, and if someone isn't literate, you can use symbols, use pictures that are relevant to them. If there's a cognitive problem, then you can limit the choices and go from there.
So we kind of already touched on this, but there's a number of patients who could benefit from this, but some of the most likely would be a patient who's intubated. Obviously, they're not going to be able to speak. Patients with aphasia might be another population you could use this with. Facial trauma, again, affecting their articulation, and then neurological diseases such as apraxia or dysarthria, where you would need to clarify what they're saying. So jumping into how this works, the first step to this is going to be establishing a yes-no response. So it's important to establish a yes and a no response to make sure they're doing this correctly, as fatigue can come into this. And for example, if you're scanning and you get to what they want, you would do maybe a thumbs up for a yes, or if you're on a letter that they isn't correct, you do a thumbs down. So you want a yes and a no. So if they're tired and don't put their thumbs up, just no response doesn't mean you're not on the right letter. But you have to take into consideration their physical abilities. So a yes and no response can be a number of things. It can be a tap, it can be an eye blink. So it's really going to be individualized for your patient. So do you guys want to demonstrate this?
Yeah, we can demonstrate a yes-no response. So the first thing that you want to do is you want to look at your medical history, learn a couple things about them. Okay, so I know this is Nicole, and she came in yesterday to Holzer. So then I would say, hi, Nicole, I'm coming to, try to help you communicate, give us a little bit more information about yourself. I'm going to ask you a couple questions. If you can put your thumbs up for yes and thumbs down for no, then that would help me make your message. So, the first question I'm going to ask you is your name Steve? Okay, she said no. Did you come to our hospital yesterday? And are you at Holzer Clinic? Okay, so that way we've established a yes and a no response that she can do. If for some reason she was unable to do this, maybe she had a problem with her limbs, then we could maybe go into a blink 1 for yes, blink 2 times for no.
And it's also important when you're deciding which one to use that you ask them to do it. So like making sure first that they're able to blink their eyes, they're able to put their thumb up before you start asking them the questions.
And again, just to emphasize, you want to ask answers that have a yes response, and then you want to ask an answer that has a no response, so that you know for a fact they understand yes and no.
Yes. So before we pass out these boards and we have you practice with these, we'd love if you get into partners and kind of practice establishing a yes-no response. So when you get into the boards, you already have that established.
You're up.
Of course not.
Can you do that over it?